Hi everyone, this is Learning English Pro and my name is Jer, your English teacher and guide. If you're a doctor working in an English-speaking environment or studying medical English, this video is for you. Today, I'll be covering essential English phrases that doctors use in daily interactions with patients. These phrases will help you build confidence and communicate more effectively in a medical setting. If this is your first time with Learning English Pro, make sure to subscribe to stay updated on all my latest lessons. And don't forget to stay tuned until the end, as I'll be sharing more videos that will help you expand your medical vocabulary even further. But let's get started on this lesson, English phrases for doctors. As a doctor, the first impression you make is crucial. Here are some common phrases doctors use to greet and introduce themselves. Hello, I'm Dr. Smith, and I'll be your doctor today. This phrase sets a professional tone and establishes your role. How are you feeling today? A polite and simple way to check in on the patient's well-being. Please take a seat and let's talk about how I can help you. This phrase invites the patient to sit down and signals you are ready to listen. These simple phrases help put patients at ease and make them feel comfortable talking about their health concerns. Now let's look at some useful phrases for gathering important medical information from your patient. Can you tell me about your symptoms? This is a general question to begin understanding the patient's condition. When did the symptoms start? This phrase will help you determine the timeline of the illness. Have you experienced anything like this before? Checking about past experiences can help identify patterns. Are you currently taking any medication? Asking this question ensures you're aware of any treatments or medicines the patient is using. These questions are essential to creating an accurate diagnosis. Always listen carefully to your patient's responses, as they'll guide you to the next steps in treatment. Once you've assessed the patient's condition, the next step is to explain your diagnosis clearly and professionally. Based on your symptoms and test results, it seems like you have the flu. It's best to start by naming the condition in simple terms. This is a common condition that we can manage with the right treatment. This statement will reassure the patient if the condition is treatable. I'd like to order some further tests just to be sure. This explains the need for more tests, keeping the patient informed. Here are some treatment options we can discuss. With this statement, you can introduce treatment possibilities and involve the patient in decision-making. Clarity is key here. Use simple language and avoid overly technical terms unless you're sure the patient understands them. Doctors often need to provide instructions or recommendations. Here's how to phrase them effectively. I'm going to prescribe you some medication to help with your symptoms. This is a straightforward way to inform the patient about medication. Please take this medicine twice a day after meals. This is how we can give specific instructions for how to take a medication. Make sure to follow up with me in a week to see how you're feeling. We would say this to encourage follow-up care and monitoring. You should get plenty of rest and drink lots of fluids. This, of course, is common advice for recovery. These phrases help ensure that your patients know exactly what they need to do to improve their health. It's important to reassure patients and help them feel at ease, especially if they're anxious or unsure about their condition. You're in good hands and we'll do everything we can to help you recover. Saying this offers reassurance and trust. This is a treatable condition and we're going to take good care of you. This statement emphasizes the positive outlook. Don't worry, we'll monitor your progress closely. Saying this ensures the patient knows you'll keep track of their condition. A few kind words can go a long way in helping patients feel more relaxed during their treatment. I hope you enjoyed these essential phrases for doctors working in an English-speaking environment. By using these, you can communicate more clearly with your patients and ensure they understand every step of their treatment. If you find this video helpful, don't forget to like, share, and subscribe for more medical English tips. And stay tuned, coming up is lots more medical-related English vocabulary. Our next topic is doctor types in English. Very, very useful. Hello, you're very welcome to this English vocabulary lesson on doctors. Let's dive right in and have a look at the lesson plan for today's video. So first up, what you need to know is that you'll be learning all about the different types of doctors and their names in English. And of course, this is Learning English Pro, so you'll be learning lots of essential vocabulary relating to each type of doctor. And with this key vocabulary comes essential context. Learn lots of history and important information about the different types of doctors you will learn in this lesson. So it promises to be a really exciting and interesting lesson for you today. So if you're ready, sit back, relax, and let's learn some English on doctors together. Our first type of doctor is a general practitioner. Now this is the British English, general practitioner. It can also be shortened to just GP. GP. Now, this might be more commonly known as a family doctor or your local doctor. In American English, it is commonly referred to as a medical doctor. And this role can also be referred to in American English as a physician. So let's move on and have a look at some additional information and context for a physician or a GP. The area of medicine they work in is known as general medicine. And did you know the earliest documentation for a formal hospital with physicians that treated patients comes from the 5th century BC in Sri Lanka? Hippocrates, who lived from 460 to 377 BC, is commonly called the father of medicine. He is thought to be one of the first physicians to treat disease as being a result of natural rather than supernatural causes. And because of him, we have the Hippocratic Oath, which is an oath of ethics historically taken by physicians. In its original form, it requires a new physician to swear to uphold specific ethical standards. Okay, it's time to move on to our next type of doctor, which is a pediatrician. Repeat after me. Pediatrician. So what does a pediatrician do? A pediatrician is a medical doctor who manages overall health for children from birth until age 18. And the area of medicine is called pediatric medicine. And the very first pediatric hospital was opened in Paris, France in 1802. Let's move on to our next type of doctor, a neurologist. Repeat after me. neurologist. Neurologists are specialists who treat diseases of the brain and spinal cord, peripheral nerves and muscles. And the field that a neurologist works in is called neurology. Neurologists treat serious conditions like stroke, Alzheimer's disease, and multiple sclerosis. Our next doctor type is a dermatologist. Repeat after me. Dermatologist. And of course, a dermatologist works in the area of dermatology. A dermatologist is a doctor who specializes in conditions involving the skin, hair, and nails. A dermatologist can identify and treat more than 3,000 conditions. These conditions include eczema, psoriasis, and skin cancer, among many others. Next up, we have anesthesiologist. This one's quite tricky. Anesthesiologist. Let's try it one more time. Anesthesiologist. An anesthesiologist works in the area of anesthetics. This provides treatments such as anesthesia, intensive care medicine, critical emergency medicine, and pain medicine. Anesthesia is a state of controlled temporary loss of sensation or awareness that is induced for medical purposes. Our next medical doctor is a dentist. Repeat after me. Dentist. A dentist works in the area of dentistry. A dentist, also known as a dental surgeon, is a surgeon who specializes in dentistry, the diagnosis, prevention, and treatment of diseases and conditions of the mouth. Have you ever thought about who the first dentist was? Heze-Ra is the earliest dentist whose name is known to us. Around 2600 BC in ancient Egypt, he was known as the chief of dentists. Our next doctor type is an oncologist. Repeat after me. Oncologist. An oncologist works in the area of oncology, but this is more commonly known as cancer treatment. These are doctors who treat cancer and provide medical care for a person diagnosed with cancer. In the area of oncology, there are three major areas: medical, surgical, and radiation. An oncologist treats cancer using chemotherapy or other medications, such as immunotherapy. Let's move on to our next doctor type, a surgeon. Repeat after me. Surgeon. A surgeon works in the area of surgery. And surgery is used to investigate or treat conditions such as disease or injury, to help improve bodily function, appearance, or to repair unwanted ruptured areas. If we look back in history, surgery in different forms has been performed by humans for thousands of years. The earliest evidence comes from over 8,500 years ago. Let's move on to our next doctor, which is a cardiologist. Repeat after me. Cardiologist. A cardiologist works in the area of cardiology, and they are doctors who diagnose, assess, and treat patients with diseases and defects of the heart and blood vessels. Let's take a moment to talk about the human heart. The average heart is the size of a fist in an adult. Your heart will beat about 115,000 times each day. It also pumps about 2,000 gallons of blood every day as well. Our next type of doctor is a radiologist. Repeat after me. Radiologist. A radiologist works in the area of radiology, and they are medical doctors that specialize in diagnosing and treating injuries and diseases using medical imaging procedures. Let's take a look at the types of imaging procedures. There are X-rays, computed tomography, which is also called a CT scan, magnetic resonance imaging, also called an MRI, positron emission tomography, PET, or an ultrasound. Let's move on to our final doctor of this lesson, a psychiatrist. Repeat after me. Psychiatrist. These doctors work in the area called psychiatry. A psychiatrist can diagnose and prescribe medication to treat a variety of complex mental illnesses, such as depression and bipolar disorder. In the area of psychiatry, a founding father of this medical field is Sigmund Freud. He was an Austrian neurologist and the founder of psychoanalysis, a clinical method for treating psychopathology through dialogue between a patient and a psychoanalyst. And with Freud, that brings us to the end of our English lesson on types of doctors. How did it go for you? I hope you really enjoyed it, and thank you for visiting my channel. I really appreciate your support. Hello and welcome to Learning English Pro. Today we'll be going through some essential phrases you'll need when visiting the doctor. Now let's jump right in. I need to make an appointment with the doctor, please. You can use this phrase to request a doctor's appointment politely and efficiently. Try it after me. I need to make an appointment with the doctor, please. Let's move on to our next phrase. I've been feeling unwell lately. This phrase is how you can express your general discomfort to the doctor clearly. I've been feeling unwell lately. I have a sore throat and a cough. With this phrase, you are describing your symptoms accurately to assist in diagnosis. I have a sore throat and a cough. I have a fever. This is what we would say in English if we have a higher than usual body temperature. Repeat after me. I have a fever. I twisted my ankle and it hurts. This is how we might explain to the doctor the cause of your pain and its location. I twisted my ankle and it hurts. I've had a headache for a few days. This is how you convey the duration of your headache for better evaluation. I've had a headache for a few days. I think I might have the flu. With this phrase, you can express your suspicions about your illness, prompting further investigation. I think I might have the flu. Let's move on to our next phrase. I need a prescription for my medication. This is how you request a prescription if it's necessary for your treatment. I need a prescription for my medication. Do I need to take any tests? This is how you might inquire about diagnostic tests that may be required. Do I need to take any tests? Is there a pharmacy nearby? With this phrase, we are asking about the availability of a nearby pharmacy for your prescription. Is there a pharmacy nearby? How much will this medication cost? This is how you inquire about the cost of prescribed medications or treatments. How much will this medication cost? Can you recommend any over-the-counter remedies? When we ask the doctor about over-the-counter remedies, we are asking for recommendations on non-prescription treatments for minor issues. Repeat after me. Can you recommend any over-the-counter remedies? What are the side effects of this medicine? We can use this phrase to learn how to ask about potential side effects of prescribed medications. What are the side effects of this medicine? When should I come back for a follow-up appointment? This phrase is for finding out how to schedule a follow-up appointment to monitor your progress. When should I come back for a follow-up appointment? Thank you for your help, doctor. And with our final phrase, we can express our gratitude to the doctor for their assistance. Thank you for your help, doctor. And there you have it, 15 essential phrases for your doctor's visit. I hope this helps you feel more confident when talking to healthcare professionals. If you haven't, in today's lesson, we're going to explore the essential tools and equipment that every nurse needs to provide the very best in patient care. We'll cover a comprehensive list of 25 crucial items, including the stethoscope, blood pressure monitor, thermometer, and many more. Each tool will be explained with a clear definition and practical sentence example or phrase, helping you understand their importance and how they are used in a hospital setting. Let's get started. Our first piece of equipment is the stethoscope. Repeat after me. Stethoscope. The stethoscope is an instrument used by nurses and doctors to listen to the sounds made by the heart, lungs, and other organs. Let's use this word in a sentence. Let me use my stethoscope to listen to your heart and lungs. Our next piece of equipment is a blood pressure monitor. Blood pressure monitor. This device is used to measure blood pressure, typically consisting of an inflatable cuff and a measuring unit. I need to check your blood pressure with this monitor. Please relax your arm. Next up, we have the thermometer. Repeat after me. Thermometer. This instrument is used for measuring and indicating temperature, commonly used to check a patient's body temperature. I'll take your temperature with this digital thermometer. It will only take a few seconds. Let's move on to pulse oximeter. Pulse oximeter. The pulse oximeter is a non-invasive device that measures the oxygen saturation level of the blood. Let's try it out in a sentence. I'm going to place this pulse oximeter on your finger to check your oxygen levels. Next up, we have glucometer. Glucometer. This device is used to measure the approximate concentration of glucose in the blood. Let's use the glucometer to check your blood sugar levels before your meal. Our next term is commonly mispronounced as syringe. The correct pronunciation is syringe. Repeat after me. Syringe. A syringe is a medical instrument used to inject fluids into or withdraw them from the body. I need to give you an injection, so I'll prepare this syringe. Let's move on to IV drip or intravenous drip. So we have IV drip or intravenous drip. This is a method of delivering fluids, medications, or nutrients directly into a patient's vein. Let's try it out in a sentence. We'll set up an IV drip to make sure you get the fluids you need. Our next term is tricky to say. Catheter. Catheter. Let's try it one more time. Catheter. A catheter is a tube that can be inserted into a body cavity, duct, or vessel to allow for drainage, injection of fluids, or access by surgical instruments. Let's check out our sentence example. I'm going to insert a catheter to help you with urination. Next up, we have bandages. Bandages. Bandages are strips of material used to bind a wound or to protect an injured part of the body. After cleaning the wound, I'll apply these bandages to protect it from infection. Let's move on to defibrillator. Defibrillator. This life-saving device is one that delivers a dose of electric current or shock to the heart to restore a normal heartbeat. Let's check out our sentence example. In case of an emergency, the defibrillator is used to restart the heart. Scalpel. Repeat after me. Scalpel. A scalpel is a small and sharp knife used in surgeries and medical procedures. Please hand me the scalpel for the incision. Next up, we have gloves. Repeat after me. Gloves. Gloves are a protective covering for the hands worn by medical professionals to prevent contamination and spread of infection. I always wear gloves to maintain hygiene while treating wounds. Our next piece of equipment is a face mask. Face mask. This is a protective mask covering the nose and mouth, or nose, mouth and eyes, worn to reduce the spread of infectious agents. Please wear this face mask to protect yourself and others. Gown. Gown. A nurse's gown is a protective garment worn by medical staff during surgical procedures or patient care to maintain hygiene. Let's try it in a sentence example. I'll put on a sterile gown before assisting in the surgery. Let's move on to tuning fork. Tuning fork. A tuning fork is a tool that provides a fixed tone when struck. This is used to test hearing or vibration sense. I'm using this tuning fork to check your hearing. Our next piece of equipment is the otoscope. Otoscope. An otoscope is a device used to look into the ears to examine the ear canal and eardrum. I'll use the otoscope to check for any signs of ear infection. A similar tool is the pen light. Pen light. This device is a small flashlight used to examine patients, especially to check pupil responses. Let's try it in a sentence. I'll use this pen light to check your pupils for any abnormalities. Next up, we have walker. Walker. A walker is a framework used for support when walking, typically for elderly or injured patients. Use the walker to help you move around safely after your surgery. Wheelchair. Wheelchair. A wheelchair is a chair fitted with wheels, used by people who cannot walk or who have difficulty walking. Let's take a look at our sentence example. I'll take you to your room in a wheelchair for your comfort. Next up, we have crutches. Crutches. Crutches are mobility aids that help a person walk when they have an injury or disability affecting the legs or feet. I'll teach you how to use the crutches to move around safely. Our next piece of equipment is the sterilizer. Sterilizer. The sterilizer is a device used to sterilize medical instruments to ensure they are free of all microorganisms. Let's try it in a sentence. All surgical tools must go through the sterilizer before being used. Our next term is medical chart. Medical chart. A medical chart is a comprehensive record of a patient's medical history and treatment. Make sure to update the patient's medical chart with today's observations. Let's move on to suction machine. Suction machine. A suction machine is a device used to remove bodily fluids from a patient's airway or surgical site. During the procedure, we used a suction machine to clear the airway. Our next piece of equipment is called an ECG machine or electrocardiogram. So ECG machine or electrocardiogram. This device is used to measure the electrical activity of the heart. Let's try it in a sentence. We'll use the ECG machine to monitor your heart's activity. Our final piece of equipment for this part of our lesson is the nebulizer. Nebulizer. This is a device that administers medication in the form of a mist inhaled into the lungs. Let's take a look at our final sentence. I'll set up the nebulizer to help you with your breathing treatment. Well done, you've done a great job of learning 25 terms for essential nursing tools and equipment. Let's move on to our next lesson, which is 100 phrases for nurses. These phrases are essential for daily interactions with patients, doctors, and other healthcare professionals. So whether you're a beginner or have some experience, this lesson is designed to enhance your communication skills in a medical setting. So let's get started. Grab your notebooks and let's dive into today's lesson. Remember, practice makes perfect, and I'm here to support you every step of the way. And our first topic is patient admission. Welcome to our facility. How are you feeling today? Welcome to our facility. How are you feeling today? Can you please fill out this form? Can you please fill out this form? Do you have any allergies? Do you have any allergies? What brings you here today? What brings you here today? Can you describe your symptoms? Can you describe your symptoms? Do you have any existing medical conditions? Do you have any existing medical conditions? Are you currently taking any medications? Are you currently taking any medications? Have you been hospitalized before? Have you been hospitalized before? We need to take your vital signs. We need to take your vital signs. Please provide a sample of your urine. Please provide a sample of your urine. Well done, that's 10 phrases learnt already for the world of nursing. Next up, let's take a look at some phrases relating to taking a patient's vital signs. I need to take your blood pressure. I need to take your blood pressure. Please roll up your sleeve. Please roll up your sleeve. I'm going to check your temperature. I'm going to check your temperature. Let me measure your pulse. Let me measure your pulse. I need to listen to your heart and lungs. I need to listen to your heart and lungs. Please breathe in and out slowly. Please breathe in and out slowly. Your vital signs are normal. Your vital signs are normal. Your blood pressure is a bit high. Your blood pressure is a bit high. Your temperature is elevated. Your temperature is elevated. I need to record your oxygen levels. I need to record your oxygen levels. Now it's time to move on to our third topic, which is medication administration. It's time for your medication. It's time for your medication. Have you taken this medication before? Have you taken this medication before? Please take this pill with water. Please take this pill with water. Do you have any difficulty swallowing pills? Do you have any difficulty swallowing pills? This injection might sting a bit. This injection might sting a bit. I'll need to give you an IV. I'll need to give you an IV. Are you experiencing any side effects? Are you experiencing any side effects? This medication should help with your pain. This medication should help with your pain. Make sure to take this with food. Make sure to take this with food. Let me know if you feel any discomfort. Let me know if you feel any discomfort. It's time to move on to our next topic, which is patient care. How are you feeling today? How are you feeling today? Do you need help with anything? Do you need help with anything? Are you in any pain? Are you in any pain? Can you rate your pain on a scale from 1 to 10? Can you rate your pain on a scale from 1 to 10? Let me help you sit up. Let me help you sit up. I will assist you to the bathroom. I will assist you to the bathroom. Do you need help changing your clothes? Do you need help changing your clothes? Let me adjust your pillow. Let me adjust your pillow. Would you like a blanket? Would you like a blanket? Can I get you anything to drink? Can I get you anything to drink? We are already on our 5th topic, wound care. I need to change your dressing. I need to change your dressing. This might hurt a little. This might hurt a little. I'm going to clean the wound now. I'm going to clean the wound now. We need to keep this area dry. We need to keep this area dry. Please try not to touch the wound. Please try not to touch the wound. The wound is healing nicely. The wound is healing nicely. I'm going to apply some antibiotic ointment. I'm going to apply some antibiotic ointment. You may feel a bit of pressure. You may feel a bit of pressure. I will bandage this up for you. I will bandage this up for you. Let me know if it starts bleeding again. Let me know if it starts bleeding again. We are halfway through our English lesson on phrases for nurses. Next up, our topic is patient education. It's important to take your medications as prescribed. It's important to take your medications as prescribed. You need to follow a low-sodium diet. You need to follow a low-sodium diet. Regular exercise is beneficial for your health. Regular exercise is beneficial for your health. Make sure to stay hydrated. Make sure to stay hydrated. Here's how to manage your condition at home. Here's how to manage your condition at home. Always wash your hands before eating. Always wash your hands before eating. Avoid smoking and excessive alcohol consumption. Avoid smoking and excessive alcohol consumption. Monitor your blood sugar levels regularly. Monitor your blood sugar levels regularly. This pamphlet contains useful information. This pamphlet contains useful information. If you have any questions, don't hesitate to ask. If you have any questions, don't hesitate to ask. Our seventh topic is communication with doctors. I need to update the doctor on your condition. I need to update the doctor on your condition. The doctor will be in to see you shortly. The doctor will be in to see you shortly. Let me check with the doctor about that. Let me check with the doctor about that. The doctor has prescribed a new medication for you. The doctor has prescribed a new medication for you. I need to report this symptom to the doctor. I need to report this symptom to the doctor. The doctor has ordered some tests. The doctor has ordered some tests. I will consult with the doctor about your treatment. I will consult with the doctor about your treatment. The doctor has requested a follow-up appointment. The doctor has requested a follow-up appointment. I'll inform the doctor about your pain. I'll inform the doctor about your pain. The doctor will review your test results. The doctor will review your test results. In our next topic, we will take a look at phrases you can use in an emergency situation. We need to act quickly. We need to act quickly. Stay calm, we are here to help. Stay calm, we are here to help. Call for emergency assistance. Call for emergency assistance. I need to check your vital signs immediately. I need to check your vital signs immediately. Please follow my instructions. Please follow my instructions. Are you experiencing chest pain? Are you experiencing chest pain? We need to start CPR. We need to start CPR. The defibrillator is on its way. The defibrillator is on its way. I need to stabilize you before the doctor arrives. I need to stabilize you before the doctor arrives. You are in good hands. You are in good hands. Let's move on to our penultimate topic, discharge instructions. You are ready to be discharged. You are ready to be discharged. Here are your discharge papers. Here are your discharge papers. Make sure to follow up with your primary care physician. Make sure to follow up with your primary care physician. These are your home care instructions. These are your home care instructions. Take your medication as directed. Take your medication as directed. Schedule a follow-up appointment. Schedule a follow-up appointment. If you experience any complications, contact us immediately. If you experience any complications, contact us immediately. Keep the wound clean and dry. Keep the wound clean and dry. Avoid strenuous activities. Avoid strenuous activities. Thank you for choosing our facility. Thank you for choosing our facility. It's time to move on to our final topic for this lesson, general courtesy. How can I assist you today? How can I assist you today? Please let me know if you need anything. Please let me know if you need anything. I'm here to help you. I'm here to help you. Your comfort is our priority. Your comfort is our priority. Thank you for your patience. Thank you for your patience. I appreciate your cooperation. I appreciate your cooperation. We aim to provide the best care possible. We aim to provide the best care possible. Feel free to ask any questions. Feel free to ask any questions. I will be with you shortly. I will be with you shortly. Have a great day. Have a great day. Well done, you've learned 100 new phrases. These phrases should help nurses in their daily interactions and ensure clear, effective communication with patients, doctors, and other healthcare staff. And don't go anywhere because our next lesson is coming right up, nurse types in English. Today we're delving into a captivating topic that bridges languages and cultures, nursing roles. As we navigate through this enlightening journey, we'll not only explore the array of roles within the healthcare realm, but also unravel the fascinating linguistic differences between American and British English. If you want to follow along with the lesson, all the words covered today are in the video description. Okay, let's get right to it. Our first role is a registered nurse, or abbreviated to RN in the United States, or a registered general nurse in the UK, an RGN. This type of nurse provides direct patient care, administers medications, monitors patients' conditions, and collaborates with doctors to plan and implement treatment. Next up, we have a licensed practical nurse, an LPN, in US English. In UK English, it's called an enrolled nurse, or an EN. This type of nurse assists with patient care, performs basic medical tasks, and monitors patients' vital signs under the supervision of RNs or doctors. A certified nursing assistant, a CNA in US English, or a nursing auxiliary in UK English, provides hands-on care to patients, assisting with activities of daily living such as bathing, feeding, and dressing. A clinical nurse specialist in American English, or advanced nurse practitioner in UK English. These are advanced practice nurses who specialize in a specific care, like pediatrics or critical care, and they provide expertise in patient care, education, and research. In American English, our next role is referred to as a nurse practitioner. In British English, it's called a nurse prescriber. These are advanced practice nurses who can diagnose and treat medical conditions, order tests, and prescribe medications, often working independently. A certified registered nurse anaesthetist in American English, or simply a nurse anaesthetist in UK English, administer anesthesia to patients who are undergoing surgery, ensuring their comfort and safety during procedures. A certified nurse midwife in the US is simply called a midwife in UK English. They provide care to pregnant women before, during, and after childbirth, offering a holistic approach to maternity care. A pediatric nurse in American English is called a children's nurse in UK English. These nurses specialize in caring for infants, children, and adolescents, addressing their unique medical and emotional needs. A neonatal nurse is a term used in both US and UK English. These refer to nurses who care for newborns, particularly those born prematurely or with medical complications. And this is usually done in neonatal intensive care units. An oncology nurse in the US may be called a cancer nurse in the UK. These types of nurses specialize in caring for patients with cancer, providing support, administering treatments, and managing side effects. An emergency room nurse is a general term, and this relates to nurses who work in the fast-paced environment of the emergency room. Their work involves assessing and treating patients with various medical emergencies. Our next term is intensive care unit nurse. Intensive care unit is usually abbreviated to ICU, so this nurse is typically called an ICU nurse. And they care for critically ill patients, monitoring their conditions and administering specialized treatments in intensive care settings. Let's move on to the operating room nurse. These nurses assist surgeons during surgical procedures, ensuring that the operating room environment is sterile and safe. A psychiatric nurse specializes in mental health care, providing support, therapy, and medications to patients with psychiatric disorders. Let's move on to geriatric nurse. Geriatric nurses care for elderly patients, addressing their unique health needs and promoting quality of life in aging populations. A rehabilitation nurse works with patients recovering from injuries or surgeries, helping them regain mobility and their independence. Our next nurse role is the community health nurse. Community health nurses provide care and education to individuals and families within communities, focusing on preventative care and health promotion. School nurses care for students' health and well-being, managing medical needs and promoting a healthy school environment. A hospice nurse or a palliative care nurse provide compassionate care to those who are terminally ill and their families, focusing on comfort and quality of life. And last but not least is the travel nurse. Travel nurses work on short-term assignments in various healthcare settings, often moving between hospitals or regions to address staffing needs. Today we're focusing on medical vocabulary essential for the Occupational English Test or OET exam. Whether you're a nurse, doctor or other healthcare professional, having a strong grasp on these terms will help you communicate effectively and succeed in your test. Now let's get back to our lesson on essential vocabulary for the Occupational English Test. In this lesson, you will learn the pronunciation and definition for each word or term. Then we will put our English conversational skills to the test with an English phrase and learning additional information about the term along with keywords to use with it. Let's get started. Our first term is anamnesis. Repeat after me. Anamnesis. This word means a patient's account of their medical history. Let's take a look at our first example phrase. The doctor took a thorough anamnesis before diagnosing the patient. Anamnesis involves asking the patient about previous illnesses, surgeries, allergies, medications, and family history. This comprehensive history helps the healthcare professional understand the context of the patient's current condition. Our next term is prognosis. Prognosis. A prognosis is the likely course of a disease or ailment. The prognosis for recovery is good with early treatment. A prognosis may include expected recovery time, potential complications, and overall chances of recovery. It's based on statistical data, clinical experience, and individual patient factors. Etiology. Repeat after me. Etiology. The definition of etiology is the cause or origin of a disease. Let's take a look at our conversation phrase example. The etiology of the patient's symptoms was determined to be bacterial. Understanding etiology is crucial for effective treatment. Diseases can have multiple etiologies, including genetic, infectious, environmental, and lifestyle factors. Up next, we have acute. Repeat after me. Acute. If a symptom is described as acute, it is a condition with a rapid onset and a short course. She was admitted to the hospital with acute appendicitis. Acute conditions often require immediate medical attention. Examples include acute myocardial infarction, acute bronchitis, and acute pancreatitis. Chronic. Chronic. In a medical context, if something is chronic, it is a long-developing syndrome or condition. Chronic asthma can be managed with proper medication. Chronic conditions persist over a long period, often for life. They can be managed but usually not cured. Examples include diabetes, chronic obstructive pulmonary disease, and hypertension. Our next term is remission. Repeat after me. Remission. Remission is defined as a period during which symptoms of a disease are reduced or disappear. Let's take a look at our example phrase. The patient's cancer is in remission following chemotherapy. Remission can be partial or complete. During complete remission, no signs of the disease are detectable, but it does not necessarily mean the disease is cured. Exacerbation. Exacerbation. This term means a worsening or flare-up of symptoms. The patient experienced an exacerbation of their asthma due to the cold weather. Exacerbations often require adjustments in treatment. Triggers can include infections, allergens, and changes in weather or medication. Let's move on to palliative care. Repeat after me. Palliative care. This is specialized medical care focused on providing relief from the symptoms and stress of a serious illness. Palliative care improved the quality of life for the patient with terminal cancer. Palliative care aims to improve quality of life for both the patient and the family. It can be provided alongside curative treatment. Our next term is idiopathic. Idiopathic. Idiopathic means pertaining to a disease with no known cause. The patient was diagnosed with idiopathic pulmonary fibrosis. Idiopathic conditions often require extensive investigation to rule out known causes. Let's move on to nosocomial. Nosocomial. Nosocomial refers to infections acquired in a hospital setting. Let's check out our example phrase. The patient developed a nosocomial infection after surgery. Nosocomial infections can be prevented through strict hygiene and infection control practices. Let's move on to iatrogenic. Iatrogenic. This refers to a condition which results from the activity of healthcare professionals or medical treatment. The rash was an iatrogenic effect of the medication. Iatrogenic conditions can result from medications, surgeries, or other treatments. Prophylaxis. Prophylaxis. Prophylaxis describes measures taken to prevent disease. Our example phrase is, prophylaxis with antibiotics can prevent infections after surgery. Prophylactic measures include vaccinations, medications, and lifestyle changes. Let's move on to pathognomonic. Repeat after me. Pathognomonic. This describes something which is specifically characteristic or indicative of a particular disease. Let's take a look at our example phrase. Koplik spots are pathognomonic of measles. Pathognomonic signs help in the definitive diagnosis of diseases. Let's move on to comorbidity. Repeat after me. Comorbidity. This describes the presence of one or more additional conditions co-occurring with a primary condition. Let's use it in an example phrase. The patient has diabetes with comorbid hypertension. Managing comorbidities is crucial for comprehensive patient care. Histopathology. Repeat after me. Histopathology. Histopathology is the microscopic examination of tissue in order to study the manifestations of disease. The histopathology report confirmed the presence of malignancy. Histopathology is essential for diagnosing various cancers and other diseases. Let's move on to auscultation. Auscultation. Auscultation is listening to the internal sounds of the body, typically with a stethoscope. Auscultation revealed wheezing in both lungs. Common areas for auscultation include the heart, lungs, and abdomen. Next up, we have palpation. Palpation. This is the technique of examining parts of the body by touch. The doctor used palpation to detect abnormalities in the abdomen. Palpation helps in assessing organ size, shape, and tenderness. Cyanosis. Cyanosis. Cyanosis is a bluish discoloration of the skin due to poor circulation or inadequate oxygenation. Cyanosis was observed in the patient's lips and fingertips. Cyanosis can indicate respiratory or cardiovascular problems. Our next term is dyspnea. Repeat after me, dyspnea. This term describes difficult or laboured breathing. The patient reported experiencing dyspnea upon exertion. Dyspnea can be a symptom of various respiratory and cardiac conditions. Our next term is edema. Repeat after me, edema. This describes swelling caused by excess fluid trapped in the body's tissues. Let's check out our example phrase. The patient had pitting edema in the lower extremities. Edema can result from heart failure, kidney disease, or liver disease. Let's move on to hypoglycemia. Hypoglycemia. Hypoglycemia is an abnormally high blood glucose level. The patient was admitted with hypoglycemia due to uncontrolled diabetes. Symptoms of hypoglycemia include frequent urination, increased thirst, and blurred vision. Hypertension. Repeat after me. Hypertension. Hypertension describes high blood pressure. Our example phrase is, lifestyle changes can help manage hypertension effectively. Hypertension is a major risk factor for cardiovascular diseases. We also have the term hypotension. Hypotension. Hypotension indicates low blood pressure. The patient experienced dizziness due to hypotension. Hypotension can cause symptoms like dizziness, fainting, and shock. Tachycardia. Tachycardia. This term describes an abnormally rapid heart rate. The patient's tachycardia was managed with medication. Tachycardia can be caused by stress, anxiety, fever, or heart conditions. Let's move on to bradycardia. Bradycardia. This describes an abnormally slow heart rate. The athlete's bradycardia was considered normal due to their high fitness level. Bradycardia can be normal in well-trained athletes, but may indicate a problem in others.